thank you for taking the time to join us today as we talk about how our community members are involved in helping us change the game in fundraising. Their inspiring stories of resilience and personal experience with cancer, I'm sure, will motivate you as they have me. We'll also be looking at the significance of backing groundbreaking new ideas led by the brilliant emerging scientists in blood cancer research. We hope that you find this session both interesting and enlightening. As I said, just a couple of bit of housekeeping. Please keep yourselves on mute. We are also recording this session so that we can use it and we can send it out to people that couldn't make it today. If you do have any questions, please pop them in the chat box. You can see the chat box at the bottom of the screen there, and I will weave those questions into the conversation as I move forward as well. It's great to see so many people here, which is wonderful, and some very familiar faces. Thank you for taking the time to be with us today. Now, let me introduce our guests. Firstly, I'd like to introduce Clint Trofa. Clint is a 45-year-old father of 3 and one of Cure Cancer's most enthusiastic fitness fundraisers. Clint's personal experience with cancer has inspired him to support the organization's mission. Clint battled testicular cancer for 5 years in his 20s before finally becoming the all clear. But 2 years ago, he received another diagnosis for chronic lymphocytic leukemia, or CLL. This is a type of blood cancer with no known cure. Nevertheless, Clint remains very optimistic and focused on his passions, such as supporting cure cancer and staying fit. Welcome, Clint.
Hi, thank you.
Secondly, I'd like to introduce Buzz. Buzz and a member of General, which is a passionate community of content creators who aim to make the world a better place, and one of our biggest supporters. We featured Buzz's story in our recent tax appeal campaign back in June, in which he shared his very personal experience about being diagnosed with leukemia at only 19 years of age. And he had to navigate through all those challenges of treatment, as you might imagine, but with the added diversity of having the lockdown during COVID in Victoria. He was the first person to undergo a trial-based treatment where he met Dr. Ashley Eng, one of the key researchers in the clinical trial, and we'll be talking to Ashley in a minute. But first of all, welcome, Buzz. And finally, to Dr. Ashley. Dr. Ashley is a brilliant leukemia researcher, I think it's fair to say. He was a Cure Cancer grant recipient in 2011, and today he's a senior research officer at WeHi and a senior hematology consultant at the Royal Melbourne Hospital and Peter MacCallum Cancer Centre. He also co-leads the development of the clinical and genomics registries for the Asia Pacific Leukemia Consortium. Ashley is a clinical researcher who is revolutionizing our understanding of blood cell development and stem cell function, whilst also spearheading the development of new treatments for ALL, or acute lymphoblastic leukemia. His Cure Cancer funded research helped him to discover that an extra copy of the ERG gene in a model of Down syndrome drove the development of a blood cancer from stem cells. He has continued this research and was awarded the Metcalfe Prize for Stem Cell Research in 2022. Welcome, Ashley.
Thank you, Andre. Thank you very much.
Lovely you're here today. Thank you for joining me. For those that are listening in, I will be asking questions to all the members of the panel. Again, if you'd like to add another question, please pop it in the chat and I will weave that into the conversation. So first of all, Buzz, let's kick off for you. I gave a brief introduction about you, but for those that haven't heard your story or are less familiar, can you give us a bit of background about you, yourself, and your journey with cancer?
Yeah, definitely. So back in 2020, 10th of the 10th, 2020, I was diagnosed with ALL. Was always a bit of a gamer and always into the tech side of things, and it's almost come full circle. Throughout all my treatment, Dr. Ashley was my head research hematologist doctor. And yeah, through sort of getting through my treatment, Ash was always the go-to and the head of it all. And coming out of the other side of it, I really wanted to push the boundaries of see how much I could support and give back to people. After being on that trial, I think I sort of took on a big leap and wanted to make sure that I could continue helping people as well as being on that trial. Wanted to make sure that I could push as much as I can to continue that.
Yeah.
And started getting involved with the Cure Cancer Australia and Game on Cancer guys through the generosity team that I work with. And yeah, it turned out to be full circle that Dr. Ash was funded by these guys back in 2011. So it's been a pretty cool full round circle to come back to and keeping the involvement and keep the support going.
Yeah, absolutely. And what a journey you've had. I mean, Generosity are a very important partner to us and have supported us for 4 years now. So it's only right that it's kind of done a full circle, and you were treated by one of our alumni. I touched on the fact that you were diagnosed with ALL at the age of 19. I mean, it's a shocking diagnosis at any age, but 19, it must be particularly hard to deal with. Do you mind just sharing a bit of that story and how you dealt with the situation back then?
Yeah, absolutely. It was a bit of a shock to the system, really. There'd been sort of cancers throughout the family, and this definitely wasn't one that we were expecting. Very random, out of nowhere. I was sort of as fit as I'd ever been. I was working 6 days a week. I was playing sports for State Victoria. I was pretty well covered and getting into a really good spot. I've been a bit of a bigger kid my whole life, and those couple of years I've been working pretty hard to change that. So fitness wise, I was in my head probably in the best place I'd ever been. Still working full time, played a lot of games, still had a very active lifestyle and very involved with a lot of different communities in sports, gaming, tech, bit of everything. So it definitely was a bit of an instant lockdown. Along with COVID, I was still working through COVID, so it still was a bit of a shock to the system because I hadn't really had a lockdown where I wasn't doing something. So getting the diagnosis was straight down to Peter Mac. Was in Royal Melbourne Hospital, and that was quite a shock to the system. Throughout my life, I'd had my sort of ups and downs with health. I'd had burst appendix when I was like 10, so I'd been in hospital for 6 weeks during that. Like I'd had my fair share of hospital visits and long stays, but the reality of that settling down to be an actual long-term stay in hospital was quite daunting. It definitely took a lot out of me. Like I'd come from a fairly active lifestyle and being out all the time doing something, never really had any time to sit down and do nothing. So this was a very sort of unrealistic thing in my head, and it took me quite a long time to process it. I think it took me a couple of weeks in hospital to sort of sit down and actually process what had been told to me. The day that I was diagnosed, I didn't really expect it. I just thought it was COVID. Had a GP appointment. They said, oh, it sounds like it could be glandular fever, but it sort of strayed away from that because my bloods were just a little bit too far gone for that to be the case. So that news sort of struck that there was something a bit more serious going on. And then the news that I had to be taken down to Peter Mac for diagnosis was definitely rough for me and all the loved ones around me at that time.
Yeah, absolutely. And I mean, how do you process that? You know, you said it took time, but to hear that, obviously, as soon as you hear that word cancer, you probably started to think the worst.
Yeah, definitely. It had never really been something that I'd sort of actually taken time to look into. Like my mum had been through bowel cancer when I was young, and my dad had a bit of a tumor as well. So there was always that fear of cancer being directly related to the family, but to sit down and actually process that I have it, but it was nothing that was really genetic based. It was just a very random shit luck kind of thing, I guess. That was definitely hard because the loved ones, they did see me doing so well and sort of pushing to be doing anything that I could and working and out with all the nieces and nephews, doing something with them on the weekends and gaming with friends. And there was always something that I was doing. So definitely took my time to not force myself, but set the time aside to actually think, well, I'm going to have to take this day by day because I can't change it. I definitely had a very positive attitude throughout it. I was told quite a lot that I was always very positive and never really had bad days, I guess. There was definitely bad days along it, but I think I kept a really positive mental state, which made a massive difference, be able to process it a lot easier.
Yeah, absolutely. And during our tax appeal, which you were part of, and thank you for that, there was a quote that you gave us, which I found very poignant around your 21st birthday. Do you want to share that with everyone? I mean, that really talks about what you're going through and the challenges.
Yeah, so 21st, I was back home, but for my 20th birthday, that was my first bag of chemo on my birthday, which was was quite an interesting trick that I'd been planning this birthday in 2020, coming up to November. Diagnosed in October and started treatment in November. It definitely took a toll out of it, that you're putting a lot of time and effort into planning something that you're looking forward to. And then on that birthday, I was in a hospital bed with a bag of chemo. Definitely changes your perspective on things and how quickly something can change. But definitely kept a light side of it all too. There was never really a dull moment. I'd always tried to keep it funny and keep Dr. Ash on his toes and keep the nurses running around after me. But I think the birthday, that was definitely a rough day. I couldn't sort of be with family. I'd always been a very family orientated person. And that definitely took a toll out of me on that birthday, not being able to be with family directly and in a hospital bed on my own. I could only have one visitor per day during the COVID lockdowns. As you can imagine, it was quite strict. Plus being immunocompromised as well as having COVID around, there was sort of not a lot of interaction that I could have with the family. And that birthday in hospital was very sort of daunting coming up to it.
Yeah, absolutely. I can't imagine how daunting it was. And when we talk about the impacts of patients going through cancer treatment during COVID, and it was a significant impact, and we're joined by people here from all around Australia, but as many of us know, Victoria was under lockdown for significantly longer than any of the other states, and I think the longest time in the world. How did you deal with that, trying to go through a treatment plan and be in hospital for 9 months, a year of lockdown?
Definitely, that's where the gaming came into play. having the tech. So during the treatment, I was across the road from Peter Mac in the Leukaemia Foundation apartments. So during the first couple of months being pretty much stuck in that hospital bed for the intensive treatment, that was rough. The only thing that I could sort of had with me was the laptop to watch movies and sort of watch YouTubers and watch streamers. So there was always the involvement there. That was my biggest coping mechanism, was the escape into that sort of gaming world, watching streamers and watching movies, and having that sort of fake reality there that did create a bit of an escape from it all was definitely a huge thing. Always having that connection with family through FaceTime and talking to the kids and trying to keep involved with people as much as I could. That paid off a lot. And the more I got involved with the streamers and content creators and gaming, I think the more positive I became, because it gave me something to look forward to coming out the other side of it. Was definitely a huge part of the coping mechanism to get through it all and have that great escape to be able to deal with it.
Yeah, absolutely. We'll come back to your treatment in a moment, but I just wanted to have a quick chat with Clint first of all as well. So thank you, Clint, for joining us. And I touched in the summary that you'd had a couple of instances of cancer. Do you mind sharing your journey and how you've progressed over the last 10 or so years?
Yeah, thank you. Yeah, well, look, about 20 years ago, I was introduced to cancer, testicular cancer. Not knowing much about cancers at all and having had a lot of experience, I had a close friend who went through a similar thing, and I found myself having a normal day one day, and then the next day I was rushed into hospital, and there was all these tests getting done, and it was quite overwhelming, and I was sort of informed that this is not looking great, and we need to remove the tumor straight away. And I was just I suppose you don't have a lot of time to comprehend what's going on. In saying that, I was as positive as you can be, as I've already heard from Buzz. You just got to try and stay positive and put your faith in doctors and scientists and everyone in this field, because it's a great unknown. After having the surgery, I got many tests. I started to get used to all the tests and scans, and I was very lucky, as I didn't need a lot of treatment after having the tumor removed. Though when it comes to the psychological side of things, it was always on my mind. Is going to come back, and how to sort of navigate that is something very new for me, definitely. But I got through 5 years, and I got the all clear. And to be quite honest, I didn't think I'd ever revisit this field again. And look, roughly 3 years ago, had a routine blood test, and yeah, the doctor rang me and said, "Can you please come in and see me today?" and wow, you know, and he explained to me what was going on. I had a few more tests done, and he said, "You have a blood cancer called CLL. Don't read up on it. Just you know, let's just take it a day at a time and just try and keep it simple." And yeah, so that really knocked me, you know, to be quite honest. I didn't know what to make of it. So, you know, I have a lot of support with family and friends, and yeah, I've already heard it from Buzz. You know, I just try and take it a day at a time. And you know, for example, I decided to make some big changes in my life. So I put a lot more fitness in my life. I changed my diet, what I was eating, and yeah, like I just, you know, everyone has one life, and it's very precious, you know, and I want to be around as long as I can for my one, you know. So that's a little bit on that.
Yeah. And the same way as Buzz, we've heard from Buzz about how he took up gaming, and you know, that was his release. How have you processed it? How have you worked through it? And what do you do to give you your release and take your mind off your treatment?
Well, I messed with the fitness. I started to look at charity events, and I found myself doing, you know, sort of long distance walking, and it was just fantastic. I mean, it's good for the body as it is, but it's really good on keeping your mind off things, and that's how I stumbled on Cure Cancer. I was doing an event, beach to beach event, and I actually looked up and seen that was, you know, the research in all types of cancers, and I thought, wow, you know, and I thought, I want to try and raise some money for these guys, and it turned into a massive hobby. So I actually got into a point where I finished a 65K event at the end of April, and I've been training extremely hard. And on the 9th of this month, which is in a couple of days, I was supposed to be walking 100 Ks, and I created a whole event to raise money for Cure Cancer. And I've got a back issue. That's another Zoom meeting for that one. But I had to cancel it because I've been out of action, so I haven't even been able to train of late. But I suppose what I'm trying to say is be active, you know. And as I said, with the food, I mostly eat a plant-based diet today. I did a little bit of research, and I thought, I want everything on my side. I want to keep going. You know, I've got 3 beautiful daughters to live for, and a wonderful family, and yeah, so fitness has been massive for me. It's just been fantastic.
Lovely. No, thank you, and thank you for sharing that. Now I'd like to bring in Dr. Ashley Yang. Now, Ashley, you were funded by us back in 2011, and in my introduction of you, you have many senior roles at organisations down in Victoria in blood cancer. Did you just want to explain in your terms, you know, what you focus on, and before we talk about clinical trials, etc., but you know, your background and where you've gone since our funding of you in 2011?
Yes, thanks so much for inviting me. So when I was the Cure Cancer recipient back then, I'd just done a PhD in researching in blood cell development, and I was interested in the genes that control blood cell development at stem cells level. And I was interested in this gene, a transcription factor called ERG, which has turned out to be quite important in terms of blood stem cells, and also this Down syndrome leukemia. So in my work, in my PhD, and what followed on was understanding how that gene regulated and predisposed to this blood cell development in Down syndrome infants. And it's turned out that this gene also has quite important roles in other blood cell development as well, in B cells. And follow-on work from that is actually, it's quite important in B cell leukemia as well. Not the same type of the B cell leukemia that Buzz has, but it seems to be quite important in terms of regulating its ability to grow and develop. So the Cure Cancer Foundation at the time was really important in keeping me in research. So after the PhD, people do go into PhDs either from basic science or for this type of research or from medical background, which I came from. And it's a decision point after that. Do you want to continue on? And so that funding at that time was one validation of the work that I'd done previously, but also allowed me to do the science I wanted to continue on with, and actually facilitates, even at the early level, people wanting to continue on to do more research and making these discoveries. So that was actually vitally important in terms of my career direction, and to continue on what I'm doing now. So from my other things, because I was interested in blood cancer research, I'm a blood cancer doctor and a blood doctor, and I treat in patients like Buzz and also patients like Clint in terms of other blood conditions as well. But my focus at the moment in terms of my role at Royal Melbourne and Peter Mac is in treating patients with acute leukemia. And this is something that I've been working on the last few years, both in standard of care treatment, but also developing new therapies potentially, and also understanding how our therapies are currently working by looking at what we call clinical informatics and registry development.
Yeah, thank you. And we've been talking about both ALL and CLL. Could you just explain in lay terms what the difference is between those two types of leukemia?
Yeah, so types of leukemia in humans can be what we call acute or chronic. And if we take, for Clint's instance, for his type of chronic lymphocytic leukemia, those types of leukemias can be fairly slow growing, and some patients I've seen with this condition for decades without needing any type of treatment. For patients with acute leukemia, that's a different kettle of fish, because the type of leukemia cells are fairly rapidly growing. And what happens fairly quickly is that people will start feeling unwell because the normal blood cell production is interrupted by these leukemia cells, which grow and fill up the bone marrow, which is where the normal cells are made. So you start feeling a bit tired because your red cells go down. You start potentially getting bruising and bleeding because the platelets, which help with clotting, go down, and your white cells also go down, which predispose you to infection. And we know that without therapy for acute leukemia, people run into troubles quite quickly from those problems. So it's a very different scenario. There are two types of acute leukemia. Acute lymphoblastic leukemia as a group is probably the most common childhood cancer overall, and then it becomes a bit less prominent as you age. Acute myeloid leukemia is a different type of acute leukemia, and that's a disease of more adulthood and older age. The same with the chronic lymphocytic leukemia from Clint is all more a disease of older age as well.
Okay, thank you for sharing that. And I'm just going to stop there and welcome those new guests to our session. We are talking with Dr. Ashley Ng, our blood cancer alumnus, both Buzz and Clint as well, about their history with blood cancer. So just moving on to clinical trials. Ashley, you started a clinical trial, and this is where you met Buzz as well. Can you talk a bit more about what that clinical trial was, please?
Yeah, so clinical trials, I can't take full credit for it. I was part of that clinical trial in terms of my institution, but clinical trials require a lot of thinking from investigators, and this was led by Matt Greenwood from Sydney, who developed this helped develop this concept. And all trials thinking about have the question, can we do better in terms of our treatments today? So we know that we give our patients certain types of chemotherapy for leukemia, but all of that way we do things now has evolved over time from clinical trials. So from very early on, for example, even if you go back a few decades, within living memory, we didn't used to treat patients with leukemia at all. And at the time, in childhood cancers, pediatric acute lymphoblastic leukemia, it was thought that the patients should just be made comfortable. It actually took a clinical trial, an investigator here from Professor John Colbatch at the Children's Hospital, to start thinking about, can we do better than this? And introduce the concept of a randomized clinical trial in Australia for treating acute leukemia. And lo and behold, from a new type of chemotherapy agent that had been discovered in the US, using that agent in children who would otherwise have been made comfortable, thanking the children and their families for enrolling them, we found that some of the children had extended life expectancies. And as the clinical trials developed, introducing new chemotherapy agents and new understanding of the disease, some of those patients became cured from their leukemia, which was only meant to be a keep comfort diagnosis. So the types of chemotherapy that we use now have evolved through multiple trials to find out what the best outcomes that we can for our patients. And the type of trial for now we're using for acute lymphoblastic leukemia has moved more beyond the chemotherapy agents to think about the immune therapy agents. And that's the type of trial that Buzz was enrolled in, is using a newer type of immune therapy agent, which had been shown to be effective as a single agent for limited time in patients with this type of B-cell leukemia, but it wasn't curative. But if we add it to other kinds of chemotherapy agents early on, could we increase the proportion of patients who do well or cured, who would possibly predict not to do so well just with chemotherapy alone?
So it's almost like a targeted combination of drugs to look at better treatment outcomes.
Absolutely. And, when we understand about cancer treatment, most of the time it's an incremental change. So one bit of treatment's better than another in combination with something else. There are some exceptions, and one of the cancers I didn't mention before is chronic myeloid leukemia, where there's a specific small molecule or targeted therapy against a specific gene mutation product which drives the chronic myeloid leukemia, and that one tablet has revolutionized that type of leukemia. But those leukemias and cancers are actually pretty rare in the overall scheme of things. And for those which don't have the targetable therapy, which is effective, it is incremental. And so we need to understand in a properly run trial to make sure it's safe, as well as measure how effective it is. And that's the type of work that we do now across Australia and the world, really.
Wonderful. Thank you for explaining that. Just a reminder, if anyone wants to ask questions, drop them in the chat and I will weave those into the conversation. So Buzz, how did you end up in a clinical trial? What did they say to you, and how long did it take you to decide if you wanted to do it or not?
It was pretty quick. I was sitting in hospital bed. I had been told by one of the nurses that the hematologist doctors were wanting to come see me. They made it pretty daunting from the start. The nurse said they have a big, thick booklet of information they need to give you. And that was just straight over my head, like, I'm going to need someone to come in here and read with me because I don't have the strength to read it. It was quite daunting. It was pretty much a no-brainer from me. I think as soon as it was mentioned to me that there was the option to be there to help other people at the same time as there could be the chance it could progress my recovery, I think I took it on pretty quickly. It took a little bit of convincing for the family to make sure they were on the same page as me, and they were a bit scared. I think a lot of the worry was from their side of things, more so me. My sisters and mum were very, very hurt that I was so quick to take it on board. But once I sort of put my mind out there and sort of spoke my piece, and they knew that I was comfortable doing it and they had a bit more information themselves, it was a pretty quick decision on my behalf. I read through all the information and sort of knew that there was risk involved and there was a bit of a 50-50 chance there of how it would go. But my biggest thing was that I'm still helping other people by doing it myself, as well as sort of gaining that chance that it could further my recovery as well. So it was a very quick decision. And I think once I had the chance to sit down and process what had already been said previously, adding that on top made it a little bit harder. But I think it was a pretty quick decision to know that I wanted to do it to help other people as well as myself.
Oh, wonderful. And were you or family just concerned about the outcomes if it wasn't a positive outcome? Was that there?
Yeah, being a trial, I guess it's a bit hard to sort of say 100% yes, but as soon as we got the information, I think it was just because I was jumping on it so quickly that my mum was a little bit, no, like, take your time and make sure you've got the information. And I think it was a very hard thing for me to explain why I wanted to do it so badly. Dr. Ash knew that I wanted to do it pretty quickly. Besides my mum sitting at the end of the bed in tears, I think the hematologists knew that I was pretty keen to take it on board, being told that I was a fairly fit applicant for it and that I was probably going down the right path to be a part of that trial. I think I wanted to take it on board pretty quickly.
Yeah, absolutely. So can you just talk a bit more about the trial then? And we've heard from Dr. Ashley about how it's a combo of drugs and a treatment plan, but how did it feel for you? How long was the clinical trial?
Bit of a blur. It was, looking back at it now, it was in and out kind of thing. Like there was a big mix of drugs. Every stage had a different concoction. There was different sort of phases for each stage. There was definitely the phases that took it out of me more than others. The vincristine side of things was the heavy treatment in stay, which was quite hard to get through. That was probably the chemo that took it out of me the most, and I definitely felt it the most out of all of them. So there was definitely phases throughout it, the long stage there of that trial, that definitely did have more of effect than others. And that's where Dr. Ash was saying those different sort of combinations targeting specific things, you could tell the difference very easily. And I guess the more sort of deteriorating side of it was the cells being killed by the chemo. You could feel the heavier treatments, that in-stay treatment. I was in hospital for a few days or a few weeks at a time, and then was out of hospital for a few weeks at a time for that treatment, for sort of on and off treatment throughout it. So there was definitely phases throughout it that had more of an impact than others. But I guess overall, the information that was provided for you and what you had to expect each time was definitely there as well. I wasn't going into it blindly and sort of coming out of it sore and hurt and run down. And I always knew what to expect, which means I could prepare for it a bit better. And it made it a lot easier to sort of deal with over that whole trial period of knowing what drugs were coming next, knowing what sort of downtime I might need after certain treatments, and what I might need to take with me into hospital to sort of deal with it, and what I could do throughout those times. Being that gaming was a big thing, and sort of having that entertainment there was huge throughout a lot of it. There were definitely phases where I couldn't do it at all. I just had no strength to sit at my desk or lay in bed and hold a controller or look at a screen for too long. So it definitely became more reliant upon watching that entertainment for a lot of that treatment as well. So yeah, different phases had different consequences and different sort of effects, which sort of made me sort of build around them a bit better and sort of learning those as they came.
Lovely, thank you. And what was the outcome? You finished your trial? And
yeah, very positive. Finished up October last year. So finished my trial completely, and yeah, cancer free from there on. And it's been a bit of a rough transition back into sort of reality. I think I've found it pretty hard getting back into reality and finding my feet and getting back into jobs and sort of knowing where I want to go. But the overall treatment was very positive and a very quick turnaround as to what was such a sort of negative thing at the start. Keeping that positive mentality, as Clint was saying before, that again, it provides another mentality over everything, that if you're positive throughout it and you're looking forward to coming out the side of it, it was gone so quickly. And that's where sitting here today and you look back at it and you think, wow, it was quite a hard slog, but you get through it. And it's a positive transition. But again, the hardship throughout it all does pay off, especially for the trials. Once you know there's some positives that came from it, it is definitely worth it.
Yeah, no, absolutely, and congratulations. I'm very pleased to hear about the positive outcome. It must be hard though, and I'll ask the same to Clinton in the moment, but you've just been through this journey that, although cancer is quite common, it's a very unique journey that you have been on. Who do you talk to? How do you manage that? I mean, it's a difficult transition from going from not knowing to knowing, and then to have a positive outcome in a short period of time. Definitely
keeping the positivity and having that involvement with the family and sort of knowing how I wanted to talk about things. A lot of the time you get the, oh, how are you going, or how are you doing during the treatment, which was a bit of a downfall because you hated talking about how you were because everyone knew that you weren't doing well. Yeah. So I think knowing how to talk about it and then being able to set your mind on what positives you wanted to gain from talking about it, as well as the connection I made with family throughout it all, definitely made a positive outcome. Coming out the other side of it, I met my partner, Ashley. She's in here watching as well. That was another massive turnaround that it was very unexpected. I was at home, probably not feeling the best about myself, and I ran into this amazing woman during sort of gaming side of things and clicked, and again gave another massive positive turnaround to it all. Met the love of my life playing games, the most random thing you'd ever imagine. And now we're living together with a gaming setup and being involved in generosity and the charity side of things, that it is that full circle that massively helps the outcome of it. And I'm so grateful for everything that we've been able to do with Generosity and Cure Cancer Australia. It does feel like giving back. And I know that what I'd been through, people look at it and say, I don't have to give back, or I don't have to do anything, because it was such a hard time. But being on a trial, coming out of that, being able to give back still and continue helping research and providing that fun side of things and giving the outlook to people that might be in hard situations, it is a massive light at the end of the tunnel. And I think just the overall enjoyment that you can get out of life, because you do get a bit of a different mindset of how you want to do things and what you want to do. That's where the gaming and content creation and having that involvement with charities is such a massive benefit as well, because you get to do what you love as well as give back at the same time.
Yeah, look, and absolutely. I mean, thank you for your support there. And for those that don't know, we our gaming channel is Game on Cancer, and with just short of $1 million we have raised through the generosity of the Generosity gaming crew. So wonderful support, and thank you for giving back, because no one needs to, but it really is appreciated. Clint, moving on to you. So 2 years ago, diagnosed with CLL, which Ashley has explained more in detail about. For you, what's the treatment plan on an ongoing basis?
Well, at the moment, I'm just at watch and wait. So we just keep getting blood tests, watching the white blood cell count. And it's been, as it's been said, it's a targeted medication, I'm told. My hematologist doesn't say a lot to me, which I quite like. He just sort of informs me what I need to know. As I ask a few questions. So I suppose in the meantime, I've got to stay positive. It's trying to be grounded, trying to live in the day, as I've spoke about, the simple things like eating well and exercising. And also try, a problem shared is a problem halved. I try to talk to a lot of people in different fields. And I suppose, if there's anyone that, I'm sort of open to talk to anyone. If someone wants to share me their problem, I feel like it sort of gets off my stuff. Yeah. But I think I'm just trying to stay fit, trying to be on top of the game. And then as things progress, or if they don't, whatever happens, I'll just deal with it when it arises.
And you just, I mean, to that point, you just have to, because as Ashley explains, this is a long burn, so this, may not change or may take years and years. So to manage your mental health as well is very important.
Yeah, that's a massive part of it. I suppose there's times where you think about you think about what's going to happen, and with the problem I'm having with my back at the moment, I have a degenerative disc disorder as well, which is just another thing to throw in the mix. And haven't been able to be physical lately, so my mental health has gone downhill a little bit, and there's days where I just go out and sit in the sun. Like I've had to resign from my job at this point, and I can relate to Buzz as in, I need to reinvent myself again and look at different fields of working. But at the moment, I can only take one day at a time. And, I suppose there's a lot of hope when, you guys are out there putting in the hard work, doing the grassroots work to cure cancers. It puts me at ease, because, your mind can race off, and I find just get myself out, do something, whatever I'm capable of doing, and trying to help someone. And if you can give someone your time, that's usually the best thing that works for me.
Yeah, and that's what an attitude to have, quite frankly. It's absolutely wonderful, and thank you. Ashley, we've heard that we've made progress, which is exciting. Where are you now with your research? You've had this clinical trial that has worked for Buzz, and I'm sure worked for others as well. What's your next steps in the treatment against ALL and blood cancers?
So in a way, it's doing what you're doing when you get to this level is to help design new trials as part of for example, the Australasian Leukemia and Lymphoma Group. We have working parties to try and understand what next best treatments available. It's also thinking about and understanding the outcomes of clinical trials done across the world, for instance, with current therapies and newer therapies, and saying, what's the next best standard of care? And if a trial shows, which is a well-conducted randomized trial, shows there's a benefit to our patients, we will then implement that as the next standard of care therapy. So it's keeping abreast of all that work being done at the very patient level and trial level, but it's also trying to improve how we do our jobs at a hospital level and patient level as well. So, COVID was a big issue because our patients were, one, it's hard to be in a room by yourself when you're giving chemo, for up to months at a time. But at the same time, our patients were at the highest risk of getting complications of COVID. So there's that balance of things. And so that's a continuous improvement from our perspective in making our patients' journey more acceptable and tolerable, and we're delivering our therapy as best we can. But also from the research perspective, so when we're talking about the trials that Buzz was on, those therapies had come up from discoveries which were made even a decade before. And so you can't necessarily rest on your laurels in terms of saying, how do we combine things which are currently available? Because those things actually come through the process of development and to testing in early phase trials, and to then, if they work, into clinical practice. So we still need to invest in the very early on stage to try and better understand our cancers, how to better treat them. And they're new, by funding that kind of research, knowing that not all the types of research will yield a therapy, but even that understanding helps set the groundwork for development of new technologies and platforms that may be useful down the track. So, for example, Clint mentioned CLL. We now treat CLL very differently to how I did it as a registrar, even less than 10 years ago, because there's small targeted molecules such as venetoclax, which came out of understanding of cell death pathways in leukemia cells. And that was research done and trials done here in Melbourne, in Australia, to understand how this venetoclax drug works. And so all that basic research, which happened more than 10 years ago, set the groundwork for development of these small molecules. So it's an ongoing process of investing your time and efforts into understanding disease to then push forward that type of new treatment development.
And that's so important. I mean, we, as everyone knows, at Cure Cancer fund early stage research, and it's vital. I mean, we fund the pipeline so that you have mid-career researchers and professors further down. But your point about having different pathways or experience, we hear all the time from our researchers, many who are on this call today, that even a unexpected result or a negative result is a learning and takes you down another path, and it all adds to an outcome as well.
Absolutely. So
thank you for sharing that. I do have a question, and it's actually for both Clint and Buzz. Buzz, we'll start with you. The experiences post your treatment and recovery in regards to pain management. Did you experience any pain post-treatment? And if so, is it an ongoing, or was it just for a short period of time?
Yeah, it was definitely coming away from the chemo had some implications along the way. I guess your body just readjusting to not being reliant upon something again. It is always going to take a toll. I had a few sort of bouts of weird sicknesses that came about. I had pneumonia that came a couple of times. So there was definitely things along the way that did cause the pain and sickness coming away from the treatment. Just with your body being so run down from being on chemo and treatment for that long, you're always going to sort of come away with some negative outcomes from it. The pneumonia was quite a scare. That was 2 bouts of pneumonia that I had that I ended up getting rushed to ER with. sort of just things that, again, coming from a trial, there's always going to be things that they weren't aware of and not things that we could sort of tell were coming. I had some issues with liver along the way. There was quite a few things that sort of came about that did have that pain aspect to it, but definitely is a cause of that body readjusting and getting the immunity back. Coming away from it, had very little immune system, was getting sick every couple of weeks. Anyone that I was around that had a cold, I'd be sick 2 days after, or you're around the nieces and nephews, their little packages of germs. So you're always going to cop something from them. Going to see the family, I came back from seeing the family a couple of times and just had a really nasty cold for a week or so. Also, the prolonged sort of terms of being sick, it stuck around for a lot longer than it normally would. So sort of just your body trying to deal with overall sickness and pain definitely was there. Getting back into gym and training was quite hard. I've left gym for a while now just because it was probably pushing myself a bit too hard to try and get back into fitness, and I was getting sort of joint pains and things like that. But I guess it's all part of coming away from that treatment. You're always going to have some sort of negative impact on the body, and you're always going to find things that are going to be quite sort of harder to deal with than they were previously. But definitely getting there. Overall health is definitely improving. I'm getting better sort of by the weeks and months that go by, and sort of doing things to try help change. And I'm always finding something new that works better than something else. And there's always something that I can do a little bit better than I've been doing previously to try and improve that. But a lot of it was, definitely sort of prolonged sickness and as getting sick easier, as well as just the random sicknesses that came along with coming away from the treatment.
Yeah, absolutely. Thank you. And Clint, because obviously you've got a big pain in your back at the moment, but from a CL perspective, have you had any pains or anything at the moment, or is it just being managed until your blood count changed?
I haven't really had any pain. I will say mental health has been a major factor, and I wonder what other people think, because it's the quiet. You sort of don't see it on the outside. You're not in pain, but I can suffer from depression and some many other areas of mental health, and it can be very dangerous, because just because you can't see it or you're not in physical pain, it doesn't mean it's not there. And it's just the unknown. Like most of us, you'd like to know what's going on and how can I fix it. That's one thing that I did. I do all this fitness, and I've turned my whole life around. I've learnt a big lesson that you can't just do one thing. You've got to sort of do the physical, the mental, and the spiritual, even for my case. Because when my back's sort of giving me a bit of grief now, I feel like if I stay on top of this, it'll keep everything, in check. But now I need to be open to where anything can help me. And the mental health's been massive for me. It really has. I need a solution. If someone gives me a solution, I'm a very committed person, and I'll work very hard at it to beat something. But a lot of the time it's just, okay, I'll see you again, and in 6 months everything's looking all right now, and we'll just reevaluate again. And it's like, you go home, and for 6 months I'd be lying if I say I wouldn't sit on the couch watching some TV and think, I wonder what's happening with that now.
Yeah.
But look, I haven't had any physical pain. It's more the mental health pain. So I hope that helps.
Yeah, no,
I'll definitely touch on that as well. The mental health side of it is huge. Sorry, that even just brushed over me. It definitely is probably the biggest part of coming away from it all. You go through such a sort of traumatic experience and such a massive change in the life, as Clint said, that the mental health side of it is always probably the biggest part of it. It is something that you've got to readjust to physically, but mentally can be a lot harder for a lot of people as well, coming through and trying to readjust to overall life again now, like cost of living, getting back into work and trying to find something you enjoy at the same time. It's a massive thing to juggle. And that was very tricky as well for me. Again, as Clint said, the mental health side of things, it can be sort of pretty dark and it can get scary and overwhelming. But as long as you've got something there that can distract you and you can find enjoyment of, and you find something to work for you, it's the biggest part of it. The mental health side of things can be definitely the biggest impact after all.
Yeah, look, and it's so important. We have many of our researchers looking at patient care, post, during, and after. And it's something that's not often considered until you're in that situation. And it's how do you communicate to people going through this, as you said, that's in a meaningful way, because quite frankly, the last thing you probably want to do is discuss it. And then two, Clint, to your perspective, it's just what you're waiting, and to be able to have a strong positive outcome. And as you said, which I found very poignant, if there's something you could fix, you would. And I completely understand that as well. Completely understand.
Yeah, look, if I can just say, I'm a firm believer that the best is yet to come. Like I might have the best 20 years of my life ahead of me. I don't know. There's no evidence to say otherwise. Yeah. So I do stay positive, and no one's positive 100% of the time. But what I found is to find a network of friends, professionals in the medical world that I stay in contact with regularly. And I find that really works for me. So yeah, I've got plenty of fight left in me yet.
Absolutely. Don't doubt that at all. Having known you for a while, Clint. So thank you. I have a question that has come in here for Ashley as well. Ashley, could you please discuss to what degree and with whom are the worthwhile outcome findings from the trials shared amongst fellow researchers and/or clinicians?
So I think all trial outcomes are worthwhile, whether it's positive or negative, you mentioned, because a negative result, as in this had no more additional benefit compared to standard of care, is also an important result, because that means we don't continue to give patients that type of therapy because it's no additional benefit. So when we do a clinical trial, there always a registrar as part of legislation for a clinical trials registry, and it will have updates that we require to fill in to where the trial's up to in terms of how it's recruited and whether it's completed. So there's an Australian Clinical Trials Registry for all the cancer trials we do. And once it has been finalised and done, we generally aim to publish the results in journals. So when we have a trial, when we finalised a trial and had analysed all the recipients and all the follow-up, we put it as a manuscript into publication. Prior to that, however, we can actually present the findings of trials often at conferences, whether it be usually in international conferences or national conferences at regular intervals, even before the trial may have closed. So there's a constant update to clinicians and researchers. In addition, we keep an eye out for, in terms of safety and monitoring, if there are any safety or issues or signals, then we need to know about it. And that's built into most clinical trials to have a safety and monitoring committee. And if those issues do come up, we get notified from the sponsor of the trial to say that we need to address these issues or stop the trial if those flags have come up. So there's a process from internally, which is regulated and observed, to public presentations and at conferences, and then finally a publication. Would generally be how we make this trial data available.
Lovely, thank you. And before we wrap up, we just have one other question. It's actually from one of our research alumni for both Clint and Buzz, which is going back to the past point about, do you both have any advice on how to support your peers or others who are going through this kind of treatment without triggering negative emotions? Clint.
Yeah, like I've said before, I think really reaching out, asking for help, getting that network of people. And, I think it's very easy to isolate. I find that there's somebody you can isolate, and it just makes everything a lot harder. There's so many people out here, especially you guys, that have put in the groundwork for this, to do this research. I think it's fantastic. It's quite easy just to stick your head under a rock and go, I wish this to go away. So if I can just say, reach out, ask for help, and just look around and see what services and where there's people to help you in this regard. There is so many lovely people, and from my experience, people in this whole industry are they're fantastic. You know, they're just fantastic people, and they want to help you, and they give you their time, and they're working hard for this. So you're not alone. That's how I'll finish.
Yeah, no, very wise words, absolutely. And as you say, I mean, I'm fortunate to be in this role, and I'm inspired by the researchers we fund every single day. It's a privilege to be amongst these people. So thank you, Clint. Buzz, any last thoughts from you?
Yeah, definitely is easy to sort of isolate yourself. As Clint said, you find yourself sort of hiding under a rock every now and then. You're not always going to be 100% mentally. It's always going to take a very heavy toll on you. You're trying to process more than one thing at a time, and a lot of those things are negative. So you're never going to be able to beat it all the time. And that's where I found it very, very easy to find ways that I wanted to talk about it. I guess every one person's going to be different in how they wanted to express those feelings and how they want to touch on what they need help with. There was definitely times where I didn't want to talk to anyone, and I didn't want any communication with anyone because I was struggling to deal with it myself. And I found it a lot easier to get that help from others if they were sort of coming to me and asking how I wanted to be helped, rather than sort of having that connection of like, how are you going, or what do you need help with directly? It's more so the question of, what do you think will help you? What do you think would work? Even just giving the examples of how you're feeling at the time may not work for other people because they don't experience it. They might be able to see that you're struggling, but they don't know how you're struggling. So giving off the information from yourself, if you've got someone around you that is struggling with it, it's always worth to ask what they might think could help them more. They may not be able to express it very well. They may not be able to sort of put out their emotions and manage that very easily. But if you can sort of see how they're struggling, what they're struggling with, definitely makes it a lot easier. Like my support groups, through a lot of it was my family and friends online. I was sort of playing games a lot, and I think growing that connection with people online, they didn't get to see me in person, but they knew that there was always something wrong if I wasn't talking to them, or if I had my mic muted, or it was the same thing with family. If I was quiet and I wasn't texting them back, or I wasn't FaceTiming, or they sort of knew that there was things that they could work around to try get that contact back with me. If I had times where I was going quiet, and I was struggling and sort of drowning in it, they knew what I wanted, or they knew what I needed to hear. And sometimes what you need to hear isn't the good side of things. You're allowed to be upset, you're allowed to be sad, and that's definitely one thing that learning acceptance as well is really important. Knowing that things are allowed to be hard, and you're allowed to be upset, and you're allowed to have those bad days is huge. I think I was so positive throughout a lot of my treatment that coming out the other side, I thought it's hard. Like there's those things there that you can't deal with yourself. There's those things that you do struggle with quietly. There was times where Ash would find me crying in a corner quietly because I didn't want to express that I was sad. So there's definitely bad times where you probably can express yourself what you want help with, and you don't have to be quiet about it. And there's definitely the support from other people that can be helpful as well, as long as you're asking what they need help with and what they think could help more, is definitely a huge step towards being better positively, mentally and physically. The mental side plays a huge game on the physical side as well.
Thank you. Very insightful words, and I'm sure many will take a lot away from that. Thank you, Buzz. Just as we said there, and if we don't get to answer your questions, and you do have questions, because we do need to wrap up now, please send an email to info@curecancer.com.au, and we will look to get that covered. Ashley, before we head off, any last words from you?
Just put my clinician hat on, and I'll just reinforce everything that what Buzz and Clint have said as a final sign off. Cancer and cancer treatment is hard, so you got to be kind to yourself and realize, as Buzz mentioned, that you're not alone. Whether with your personal friends, your family, but also we have the ability for having those supports around either your training team, your clinical doctors and nursing staff, but also, as Clint's made very well aware and very importantly raised, we have professional services for psychological and even psychiatric support, either within hospitals or from external institutions and organisations. And we know this is a really hard journey. So it's really important to be aware to just say, if you're having trouble, it's okay to speak up, because that's the way that we can help you best.
Thank you. So thank you everyone for joining our research symposium today at Cure Cancer. Buzz, Clint, I can't thank you enough It's always hard to share your story. We appreciate it. We also appreciate your ongoing support for Cure Cancer. And Clint, we hope you're back very soon doing your walk. But thank you to Buzz and Generosity, Clint, and all your efforts. We are here to support you, so is the community. And thank you finally to Ashley. Keep doing what you're doing. You are doing remarkable work. And as we know, we are making progress. And it's thanks to donors and fundraisers like those that we have on the line today that we can do that. So thank you, and thank your teams. Thank you for everyone for being here today. As I said, if you'd like more information, please email us at info@curecancer.com.au. And that's the end of our session. I hope you've enjoyed it. Thank you. If I could ask you to leave the room, and we will have left our researchers, and we'll just finish up our day that we've been going since 9 o'clock. But thank you all. I hope you found it informative, and I wish you a good afternoon. Thank you. Goodbye.
Thanks very much.
Thank you. It's a pleasure.
See you.